born ready.
Okay.
He's still not German.
All right, it's just about 5:30. I'd like to call the Health and Human Services Committee meeting to order. If I could get a motion to approve the minutes of September 8th.
Move it. Second.
All right, thank you.
Off and running.
All in favor? Aye.
Aye.
All right. We have 8 resolutions on the agenda tonight. There are no resolutions from the Office for the Aging and none from the Health Department, but we can do a couple things. We can get through the resolutions if you want to try and do that, Christine. All right. And then we can just see if there's any additions to the department reports. Under the Human Services Resolution, I'd like to consider grouping together HH1, 3, 4, 5, and 9, and then we can go over HH2 after. But if I'll go through HH1, 3, 4, 5, and 9, get a motion in a second, and then we can open it up to any discussion.
I can get a motion to bundle
Okay.
1, 3, 4, 5, 9.
All right. So
Clarko second.
HH1 is enter into a contract with Chapel House for the provision of supported case management services. And I'm believing this is a contract that's been in force for a number of years. This again would be looking at assisting homeless individuals in obtaining permanent housing by assisting with housing searches, negotiating with landlords, and just moving people into permanent housing. This is for $139,000, this contract. It's currently in the 2022 budget. And this would be the contract renewal for a year. HH3 is accepting, I think we do this on an annual basis too, accepting 100% federal funds into the department's budget. And this is from the FFFS plan, or the Flexible Fund for Family Services. This is authorizing us to take, I think, $200,000 into the budget. And this will allow the department to support some of the contracts they have that support employment services for TANF eligible applicants and recipients, and, help them get either off of public assistance or reduce their reliance on public assistance. That is also, like I said, an annual increase into the budget that comes every year. HH4 is authorizing the commissioner to fill a child support enforcement coordinator vacancy, and Terry Nolan is resigning, I believe, at the end of this month. She's retiring. She is the child support enforcement coordinator, and this would allow that position to be filled. HH5 is allowing the filling of a senior account clerk position in the accounting unit, also from a retirement per the resolution. And then last, there is a request to fill a caseworker vacancy in the Adult Protective Services unit in child welfare, or in adult services. And my understanding is that if we pass this resolution this month, this will allow the new hire to go to adult protective mandatory training in November. Correct. So could we have a motion and a second? Is there any questions on HH1, 3, 4, 5, or 9?
Five, is that the same type of thing we talked about before where? No, that's a senior clerk. It's not a new position.
No, I think it's filling of someone retired and they're asking to fill the same job at the same title.
Okay, what level?
It's
Senior clerk.
senior account clerk. We have the authorization to fill there.
That's fine, it's just.
Yep.
In 9, there's another vacancy.
Pardon me?
In HH9.
9 is a caseworker vacancy. They had a caseworker just leave, and they are asking to fill it to replace that position in adult protective services.
Is this a frequent occurrence?
The caseworker turnover, yes, unfortunately. We have had quite a bit of caseworker turnover in the last few years. So we're hoping, we actually put this resolution in a little bit late because we have the opportunity to get a new candidate into a training that starts in November. So I wanted to push it through.
So I think we brought others on board and they've left quickly, but Better up.
Some don't pass probation.
Some of it, right, some of it's not passing probation, some of it is better opportunities. There's a variety of reasons.
Something we're missing as a wedge.
Something that we're missing. I think it's a tough job.
I'm sorry. I'm thinking off the cuff here. I don't mean to put you on the spot.
No,
No, that's
And
okay.
and I will talk privately sometime if you want to. I think it seems a shame to have turnover in needed positions like this. And I know high burnout. But we can talk another time.
Yeah.
I'm sorry. I was-
No, I
No,
know.
and there is a huge investment in training someone.
Every time,
them.
Well,
time it takes to hire somebody,
Absolutely.
there's dollars in that.
Yep.
And so forth.
Believe me, we are also concerned about the turnover, and we've never seen this level of turnover. I think, as we've talked about every month up here in other departments as well. I mean, I think some of it is due to just the state of, employment, in the country, and it's happening, I think, for the caseworker positions, they're hard. They are, there's high burnout.
Hard enough under normal conditions,
Mhm.
but this, it seems,
Yeah, we ask a lot of them. They're difficult situations that they face every day. Sometimes people come to the job thinking that it's going to be a little different than it actually turns out to be, as far as, what they are asked to do, the types of things that they experience in working with families that have the problems that they do. And
Home visiting in itself can be very difficult for some people. I mean, a lot of the work gets done in the home.
Behind you, chair person.
Elaine?
I'm sorry.
Just kind of a question in general. Do we do exit interviewing? And it might really be something for,
I
is it Ferris?
do believe
Diane
that-
Ferris?
I
We do
believe-
exit interviews.
Yes,
we do,
yes.
to try to talk about like what we did well, what their experience was here, how can we improve,
Why are you leaving?
Yeah, why are you leaving?
Right.
Like, if they want to share with, any of the answers to those questions, we want to hear them. We have our staff development supervisor, now, Jed's continuing to do that. We just hired someone else for staff development. We'll continue to do exit interviews. I think they're important, not just for caseworkers.
No, that's what I mean. I was
Right.
just talking in general. Someone,
Yep.
I don't know.
Oh, I think they're
You
valuable.
guys run the day-to-day business. Sorry.
I think sometime I would like just an informal chat
Absolutely.
where we can brainstorm and just.
I want to be in that meeting. Did you say brainstorm?
Yes.
Anytime.
No,
No, I think, no, I think it'd be good to do, really.
Yep, anytime if you want to learn more about what it's, what caseworkers are responsible for, like kind of a day in the life type of thing, I had offered that out to anyone that's interested, in the lodge.
Are you trying to burn me out?
No, but I think you made the point before, you're trying to kind of set the stage for why is it worth working here at the county and.
I've asked that question 100
Yes.
times. You can
And,
go,
why.
you go to any private business and they'll tell you
Yep.
all about their company, and why it's so great to work there. You go to the county website, blah, blah, blah.
Yeah.
Mhm.
Yes, soon, we'll do that.
Sure. Okay.
Thank you.
You should have something on that.
So can we get a vote for 1, 3, 4, 5, and 9, if there's no more questions?
I do have. I'm sorry,
Okay,
but
go ahead.
This is on number 3.
Okay.
I just want to make sure this isn't a typo. We're talking about bringing in $200,000 from the FFS program services. And if you get down to the second to the last resolve, increasing 2 lines by 200,000.
Yes.
So can you tell me how we arrive at 200,000 for the resolution instead of 400,000?
So that is right. One of them is it's increasing revenue and it's taking in, the funds from the federal fund. So I asked Grace about that, and that actually is pretty common when we accept funding, that there's 2 increases for lines. Do you remember?
Is it because of the funding, right? The funding stream, you have to increase your revenue?
So we're increasing our revenue, but we're
Yeah, I
also
would
adding
think to
to,
put an expenditure in there too, make it budget neutral. I don't know. Yeah, I'm not.
That's a great question.
yeah, I think that it is.
Could you look at that before we get?
Yep, I can actually, I'll text Grace.
Okay.
Lynn's on. Lynn probably knows.
Lynn?
Lynn, are you on? Hey,
Yeah,
Lynn.
I'm here. What was your question?
On the FFFS resolution, it says increase account number by 200,000 and then increase another account number by 200,000.
Yes, one's an expense and one's a revenue.
That's,
Oh, so it's not increase.
Oh, okay, so one is an expense account that you're adding to, and one is a revenue account that you're adding
Yes.
to.
Yeah,
Okay.
that's 100% reimbursed.
All right, that makes sense.
Okay.
Okay, that's kind of what you were asking, why, yeah, okay,
Got it.
thank you. Good thing you weren't sleeping. Thanks, Lynn. Yeah. Okay, any other questions on 1, 3, 4, 5, 9? All in favor?
I,
Okay, now I did want to take page 2 separately because we got into quite a discussion last month at Ways and Means. And in this particular resolution, as I understand it, and it's in asking to create and fill an assistant payroll system specialist position in the Department of Social Services due to resignation. But it isn't until you get to the body of the resolution where you're realizing that they had a vacant junior accountant position. The plan is to unfund that junior accountant position, which is the grade 19 position. And in its place, replace it with a payroll specialist, which is a grade 60. So in this case, when someone left the department, they did a new position duty statement, they looked at the job spec, and instead of, they did retitle it, but they didn't ask for a higher level title. In fact, this ends up at a lower level title. So if I could get a motion for HH2 to create and fill an assistant payroll system specialist in a second, then I'd like to have some further discussion about that.
Nightingale, move it.
Clark, a second. Okay. You know, as I said, the junior accountant has left the department.
Yes.
You looked at the duties of the current position. Civil service classified it as a payroll specialist and the new grade of 16, which was the old grade of 19.
Yep.
I'd like, if you'd like to, I don't even know how to do this. I'll talk to Fred. I'm looking to make an amendment so that we can change the title of that resolution so it better reflects the action that's being taken. So we don't get into this discussion at Ways and Means that we did before. I would propose authorizing the legislature to create and the Social Services Commissioner to fill an assistant payroll system specialist position, grade 16 in the Department of Social Services, and unfund a grade 19 junior accountant.
Yep.
I think it will just be cleaner, and that's the action that's currently being taken.
Right.
I'll make a motion for the amendment.
Nightingale, second.
Okay. Any questions about?
and that's because of a vacancy.
Yes, apparently the junior accountant just left.
We had a junior accountant left our accounting division within DSS, and when she left, we took a look at what her duties were, and some conversation too about our ability to bring in a junior accountant. We didn't have, that was not easy for us to do, and we think we'll have better luck with this payroll specialist.
Because most of the job assignment had to do with doing the payroll.
Yeah, that was a big portion of the job. And then
Okay.
she'll also do some stuff with claims, but we can shuffle around some of the other duties to make it fit in line with the job specification and duties of a payroll system specialist.
And you feel you might have better ability to recruit and attract the
We're
payroll
hoping.
specialist than you did the junior accountant
Would,
There's currently a test being given on Saturday
for
for
the,
the assistant payroll system specialist. So we have 9 applicants that are taking that test. So we have a pool.
and then you'll have an eligibles list that you can
Yes.
draw from.
Yes.
Okay,
would you want to add that verbiage for clarity at the ways and unfund?
yeah, I'm making the motion tonight to do it so that when it
But-
gets to Ways and Means,
But add the word vacancy.
to unfund a junior accountant vacancy. Okay. Yep, however, it will be clean because you really couldn't fill it without any funding in it, so, and we went back and forth about,
I think that sends a message that it's grade 19 being
Yep.
vacated, we're going to fill it with a grade 16,
right, and unfund the grade 19.
everybody's happy.
Yep. Okay, we have a motion and a second for HH2.
For the
Right.
amendment.
Vote on the amendment
Do
first.
we have a vote on the amendment? HH2 is amended? All in favor?
Aye.
Okay, great.
Now we have to vote on the resolution as amended.
Okay, now I'd like to offer HH2 to vote on the resolution as amended to include the change in title. Yeah, first and a second.
Oh, I thought we already, second, I thought we already moved it.
You're amending it
Fred.
Either way is fine.
Okay, yeah, all right, thank you.
in favor.
Aye.
Aye.
Thank you. All right, do you have anything else you want to add?
It's not really. I talked in my report a little bit about the high numbers in emergency housing. You're up, have seen a little an uptick. I am pleased to say that we're back down under 100 again. So I wanted to let you know that we're back down into the 90s. It does fluctuate, every day, but, working hard to move people into permanent solutions. I do think that what I said in the report was that the process of evictions is really driving some of our numbers. There's people that are being evicted out of apartments that they have been in for a long time.
Because the moratorium ended.
After the moratorium ended and worked their way through the court process. I think it's hard for people to find housing. I think some landlords are just have decided that they're not interested in, having people live in the apartments that they had before, being way more choosy about who lives in them. So, some of our folks, I think are that's why they're having a difficult time, finding places to live that are, low rent. So, and we're coming into colder weather. We are seeing people come in that have been spending time outside, living outside. Even though we haven't hit the threshold of being under freezing, it's still been kind of cold some nights, and we have seen some people come in for housing.
Yeah, I was curious, and maybe I should know this, but I don't. During Code Blue, is the housing, all of the housing covered fully, 100%?
No, just the,
The sanctioned individuals, just the ones we would normally not house?
they're, yeah, coming in.
Okay.
Yeah.
Okay. So the state is saying you have to house them even if they're sanctioned, but if you do,
Yes.
we will pay.
Those are considered
There'll be
the
no
emergency house for
local.
the executive order.
Okay, all right.
The rest of them might be, typically, being housed because of an emergency
Right.
situation where they don't have housing, but they're not sanctioned, so they're not considered code blue.
So there's local contribution if it's safety net and, correct, yep.
I don't have any.
How many, what's the estimate of how many beds we actually have available? Or over,
Where?
or housing available?
You mean emergency housing?
Yeah, like somehow we have 77 people a night. Do we have 77 beds? That's
Between
not.
the hotels.
Between the hotels and the housing that we have available at Rolls and Chapel House.
Mhm.
We've been able to
Alright.
meet the need of the over 100. So with all of those combined, we somehow make it work. I mean, we've had up to 115, 120, that we were housing between families and individuals, and we met that need. Not easy. And sometimes, what the hotel has available is an issue for us.
Right.
If they're renting their rooms to other folks and they don't have availability for us, that's a big scramble for us. But, we know we consistently have availability at, certain hotels typically, especially this time of the year. And then at Rolls and Chapel House.
That's Grand Ave and Franklin Street.
Yep, Raylan White is on Grand Ave and Franklin Street is the shelter on Franklin Street.
At the shelters or the places where we house people, is it, if it's individuals, is it one person to a room or how is it?
No, sometimes they double bunk. That was something that we weren't able to do during COVID because there needed to be so much separation between folks. So we didn't double bunk sometimes for a portion of the COVID timeframe, but we're back to double bunking. And in some cases, they're triple bunked.
All right, thank you.
Thank you.
Yep. You don't mind, you guys, and then we'll go through your resolutions, Warren, and then we'll.
Are you afraid someone's gonna get sick and drop out of this group?
Yeah. Okay,
We could have run for it.
you have 3 resolutions tonight.
Yes.
HH6 is a temporary leave bank for a mental health employee.
Yes, we have someone who's had multiple health problems and will likely run out of their time by the end of this month.
I get a motion for HH6.
I'll move it.
Second.
Any in favor? All right. Okay, HH7 is the transfer from the general fund into the mental health department to cover those competency to stand trial, forensic evaluations that we've talked about in the past. And this is asking for 70,000 to come out of the general fund into the mental health budget. I would assume it's hoping to get you through till the end of the year, but this is a mandated cost that.
Yeah, it's something that it's really difficult to predict. We don't know how many of these will come through each year. So that's why we've asked for the increase because we've had quite a few this year, and in a situation where somebody was in treatment for quite a long time, which then obviously was a higher cost. So this is a cost to the county that is mandatory that we have to pay for. It's for anybody who is deemed incompetent and then goes to restoration treatment. We pay for that. If it's an OPWDD, which is developmental disability, they actually pay half, we pay the other half. If it's an office of mental health, we have to cover the 100% of that cost, as well as if people are incarcerated and need mental health treatment, they are sent to psych centers for treatment, which we also have to cover the cost of that as well. So that all comes out of our budget.
And this is the same for every county across the state.
Every county, yes.
Can we get a motion a second, then we can ask Lauren any questions? Can I get a motion a second for HH7?
I'll move it. Nightingale second.
Okay, any further discussion on HH7?
Wow.
We just don't know, Lauren, what is causing this rise and this level.
These are judge court order. These are court order.
The judges order them. I mean, it may have some, I mean, we are in a mental health crisis, so it could be the reason why the spike in that has occurred this year. I'm not sure. We don't know.
Yeah. Right. It could always just be a fluke.
Yeah, I mean, next year it could be a lot lower.
And unfortunately, this isn't treatment. Most of the cases, this is
Restoration
to
services.
see if they have the ability to stand trial.
It's different. What's restoration service? Don't mind.
So when, so two psychiatrists have to do an evaluation on someone when a competency exam is ordered. So two separate doctors have to do that, and then they go back to court. If they're deemed to be incompetent, they send them for restoration services to see if they can become competent.
So they can stand trial
So
for
they
their
can
crime.
stand trial for the crime. And it could go either way at that point. If they're competent, they stand trial. If they're not, then they'll go to treatment, like long-term treatment that we don't necessarily have to pay for that treatment when they're.
So if you go to court and it says, I don't think that my client is not competent, the judge will say, all right, then we will send him for this restoration services to determine if he can get him competent so he can come back here and stand trial.
And that has happened, where they'll come back and be competent and stand trial for the charges that they have.
Okay, favor of HH7?
Aye.
No, a lot of choice. Aye.
Aye.
Any opposed? Okay. All right, last but not least, yeah, $1 million grant. I know, who knew? Accepting the $1 million.
Yeah,
grant
so
that
this
was just
grant is
awarded.
really for diversion of substance use involved individuals away from incarceration and away from law enforcement, but more towards treatment, whether that's treatment court, treatment providers, peer services, mental health, and mobile crisis services. So mental health was the applicant for this, and then we partnered with, I believe there's like 10 agencies that we've partnered with on
In the
that.
community.
In the community to provide those services. So yes, it is a $1 million grant for 3 years.
Okay. And is Monica, did she write the grant or? was
She
it
wrote the
like-
grant, yes, through,
Yeah.
and mental health was the applicant. And part of that is to continue some things that are being done, but there's a lot of new things in this grant
Right.
to do and to work on as far as,
But
diverting people
The
away from
work
law
that's been
enforcement.
done through Healing Cayuga or the
Yeah.
study, that was a foundation for all of this.
Yes.
Yes,
Yes.
that's great. So
Mhm.
this will be,
Kudos
yes.
to Monica.
You said $1 million over 3, so that's divided by.
Yes. Yep. And some of, some things are, the partner, we work with a lot of partners on it. Some things are funded, some things don't require funding, but all working together on different intercepts of the, criminal justice system to divert people from law enforcement and incarceration that have a substance use disorder.
All in favor of accepting that money in this grant.
Aye.
And then my report was having to update on the Healing Cayuga, what they've been working on. They're funded through that study through March of next year. So they've still been doing a lot of work. I know, I think Monica put reports in everyone's mailboxes. I'm pretty
Yeah,
sure.
she did.
So just a couple things to note, that overall overdose fatalities are trending downwards, which is great news. They were down 22% in 2021. And if this year's trend continues, we will hopefully be in pre-pandemic numbers, which is great. Which is, again, nationally, they're not trending that way. They're trending upwards. They're actually up like 30%. So here in this community,
really?
we've done a lot of really hard work to keep those numbers
Wow.
down.
Dr. Duckett reported yesterday that there's been 4 fatalities to date. Is that true?
I think our numbers might reflect 7, but I don't know if that's
Okay.
like confirmed or
Okay.
toxicology reports
Yeah,
have said 4 versus 7. But, you know, there's a lot of reasons for that. I think the Narcan distribution has been has had a huge impact on that, as well as the same day initiations and the post outreach that Nick's Ride does, the peers that Nick's Ride do, as well as just the coordination of doing all that hard work through the pandemic. So I just wanted to make a note of that. That's something that they're really working on. And then obviously the continuation of the work plus some with the new grant that we just received. We're also working on an overdose spike planning. So kind of determining what is a spike, how would we notify people in the community? How do we coordinate that? And how, if it's deemed necessary, how do we notify the public about that? So we had a lot of people around the table. We're going to have some continued meetings. The health department was there, first responders, law enforcement from all the agencies in the county. So we're really looking forward to kind of organizing that. So if something does happen, we can get the information out to who we need to get that information out to. And then we've also seen an increase of overdoses happening outside the city of Auburn. So in more of the rural areas of the county, we've seen that go up in comparison to what it was. And that it takes a while for first responders to get to different places in the county. It's not like, you know, if you're located in Auburn, it's a lot closer and quicker to get there. So that's something that what we've done is we had a few happen in the same area, and we've targeted our Narcan response to those areas. There was just one over the weekend that Wally did in Conquest, and trained about 15 people in Narcan, and we're able to provide people with that, which is a good thing, especially when we see spikes happening, that we respond to those, and we're trying to push Narcan out. We also provided some of the fire departments with Narcan because it takes too long to get it from the state sometimes. So we were, I think Wally came in on a weekend and was able to provide them with Narcan for their actual fire departments as well. So that's another thing that they've been doing too. And then we're working with the school districts. We're going to be putting on kind of a joint effort. Myself and Monica are going to do a presentation for Auburn School District, but they're going to open it up to all the school districts in the county to provide information about what we're seeing with these fake pills. There's fake fentanyl pills, and kind of talking to them about how to talk to their kids about it, and how to, what's typical adolescent behavior, what is not, and what is a cause for
Fake
concern.
fentanyl?
There
I was
are
gonna ask the same
exactly.
thing.
What's fake fentanyl?
So it's
They
still
are-
something.
They're synthetic. They're made by somebody that look just like prescription pills. So you might not know the difference if you saw one. I mean, you should.
Do they have fentanyl in them?
Oh yeah.
Oh, they do.
So they're not.
They're made,
That's
but they're
right.
they're
So they're not medical grade.
Right, yes.
correct. Yes, and they're also different colors. So I know kids actually could order them online. I mean, there's a lot to take in. So we really wanted to talk to parents about that, educate them, give them some tools to talk to their kids about those types of things, as well as train them in Narcan. So we just met with Superintendent Auburn Schools, and we're going to open it up to all the school districts and hopefully do that before Thanksgiving.
One of the things I noted in the report is that it looks like the use of opiates as the drug of cause around the death is lower than one would think, and that it's like other prescription drugs and something else was in the
A
report.
lot of it is synthetics.
Yeah, and I don't, what is a synthetic? I
So
don't.
synthetic is essentially made. It's not like, an opiate,
Like Molly?
so it is called Molly, even though typically,
So like if they can't get hydrocodone or oxycodone, they'll buy it, this synthetic, the non-medical grade, and that's
well, they
in a
actually kind
hopes
of
to
make
get.
it. It's
Too
a
late.
mix of all different substances together.
Oh, okay.
It's
See,
basically.
they don't know what they're getting. It can be a
Yes.
different mix every time.
And a lot of times when people are dying from overdoses of other substances or multiple substances, it's because there is fentanyl in there. So even though it's a different drug, there still could be an opiate in there that would be,
Causing the
causing
death.
someone to die.
Chairperson, question.
Yes.
So, first of all, you two ladies know too much. I don't know if you should be running these.
Oh,
I may have not done a good job at communicating, but Marnie Medoff from Fairhaven, there was trying to get some kind of clinic together, Narcan
Okay.
or training or something to do at a storefront in the village.
Okay.
And I haven't heard whether anything happened. I might have dropped out of the emails. Do you?
Okay. I wasn't in those emails either, but I could check on that.
Yeah.
They usually organize those kind of separate from me.
Oh, okay.
Who'd you email? Do you know?
I could,
So Monica and Wally does all of
who
the
was it?
Monica and then Wally.
Yeah, Monica was
Okay.
involved in it. And then I get dropped out of the email. So I saw this lady at an event last week and she asked me, next time I see somebody else,
Yeah, I can follow up on that for you.
would you please like to sponsor those things up there?
Okay. Yes, I will do that. And then I just put a little note about the opioid settlement funds. I know there was a resolution passed
Yeah, I'm
a little
glad
while
go over
ago.
that because
So that the Community Services Board is the entity that will determine and distribute those funds. So what we have decided as the board, well, the board has decided that they're going to have the alcohol and substance use subcommittee. They're going to have presentations of agencies about what their gaps and needs are in the community and what they're seeing. And then we're going to take those, we're going to bring them back to the Community Services Board, and we're going to use that in our request for proposals for that funding. So that's kind of where it stands now. But we will hopefully by the end of the year, I'm hopeful that we'll have an RFP out there and agencies will be able to apply for that money based on the approved uses of the opioid settlement funds, as well as these needs and gaps that we've identified as a community that we're seeing in need.
and
Trying to be
once-
thoughtful
Once
about
the Community Services Board makes a recommendation, it comes to the county
Yes.
legislature. to
I will be
vote
coming
on.
back with
Yep.
resolutions when we have decided on how that's gonna go. So I wanted to make sure everybody knew. And then just really quickly, the Office of Mental Health is changing some of the clinic guidelines as far as what we can bill for and how the services are delivered, which I think are all positive changes. So we are gonna be able to bill for peer services within our clinic. OMH is really pushing peer services and they are gonna be reimbursable.
So you could contract with Next
could
Ride and then
contract.
they could have a billing source?
We could contract, yes.
Oh.
That is one of the options.
Oh.
That is, I think, great, and I think there's a place for peers in the clinic, and I think they can do some really, really good work that other people can't do.
When would it start?
So November 14th is the date that they're shooting for that to go live. You never know with new changes if timeline's gonna be correct or not, but they had another webinar today that they were.
It will be
Still sticking to
Medicaid
that.
billable.
Yeah, so anybody who has Medicaid, you would be able to be reimbursed for that, as well as doing any of our clinic services offsite. So we will be able to get reimbursed 150% if we provide, let's say, a group anywhere other than our clinic.
You get an enhanced reimbursement?
Yes, and I think that's to cover the travel cost to be going offsite to do that. So that's another big change. And I'm trying to think if there was anything else. Just some reimbursement, like billing, like the duration of what we can bill for is going to change too. So I think all in all, I'm very happy and pleased with that, the changes, but I just wanted to bring it up here because I know peer services is something that could potentially come back here at some point or not, whether we're contracting or how we decide that we want to implement that in the clinic, but I think it's definitely
You
needed.
could form a group and you could bill for the individuals in the group offsite of the
Their
clinic
Medicaid, yeah.
and without a satellite clinic or anything.
Nope, don't need anything. We don't have to do anything to our operating certificate. We don't have to ask OMH for permission on any of that. It goes live on the 14th of November. So they say.
We never hear that kind of news.
Yeah, now you need to get enough staff to do it.
Yeah.
Because we still are struggling.
We still don't have a social worker yet. There may be a little light there.
Oh.
So hopefully, we had an applicant for the case manager position that we're gonna be interviewing, hopefully next week, and then, we'll see. We haven't got the application from the social worker that expressed some interest, but I'm crossing my fingers on that one.
And once you do, you'll be able to do the crisis respite during the day, or
Yep,
the
the mobile-
crisis,
mobile
mobile
crisis, yep.
crisis.
Yep.
Great.
All right.
And Lauren, is everything set up and running at the jail, the MAT program?
So yes, the mandate went-
for that.
Yeah, it was last week that the mandate took place. We think we had most of it organized. We did apply for a waiver for the methadone piece that was denied from Oasis 2 days before the mandate. So we applied for a waiver that would have allowed us to have 6 months without needing to provide the methadone because we don't have an OTP that
Provider.
prescribes methadone in this county yet. Because Farnham is not up and running yet, and they won't be till the end. Well, they're still shooting for the end of the year. That was denied. So we found out about that a couple days before that. So we've been working with Farnham and the sheriff. We've been having meetings about how we're going to make sure that we meet that need.
So
Now,
the state said, figure it out
Yeah.
and make sure methadone is available to
Yes.
people who want that.
yes, or who are already on it.
Or who are. And do you have their number?
So I think we have a plan.
Okay.
Yeah, we have a plan, but we weren't expecting that to happen, but.
Right.
So yeah, as far as I know, that everything is in place for that to be happening at the jail. I know it's a heavy lift at the jail to provide this.
Yeah.
So I know that, I don't know if the sheriff has
talked about
talked to you about it a little bit, but there's definitely a lot to look at, a lot to oversee, a lot to organize. And we only had the $100,000 funding to do it, which.
Yeah.
Yeah. It's a hard thing to reach.
I just want to commend you for what you do. And also listening to Dr. Duckett last night was eye-opening. I mean, he gave an oversimplified version for an old poke like me, but it was very informative. What's out there, what's coming, what he sees, the mixing and the molly and it's just like, oh my God. But I want to encourage you to do outreach to inform anybody that'll listen, parents, try to get ahead of this before we have, more fatalities. Yeah, the numbers are down. He said last night there were like 5, but 5's too many. So.
And there's still overdoses happening and people are using Narcan. We've seen the evidence there that people are using.
And like you said, it seems to be more rural now than it was before. So, yeah, go get them. Thank you.
Anything else from Lauren? All right.
Thank you.
Kathleen and Brenda, I'm sorry you didn't have any resolutions, but you'd like to.
Let me go first.
There's always good information to share. So, we saw a report. It's kind of a lot of fun stuff on the report here. Lead poisoning prevention week is fun action week, but we bring attention to it, and I believe there'll be a proclamation at the legislative meeting. Lot of shots being given for children back at school. Of course, the COVID clinics continue and our flu vaccine. We did have a drive-through clinic for county employees. We're actually going to plan one in the county office building for people. And we're bringing the flu vaccine out to the jail also for the staff there, as well as the incarcerated individuals. Walk to school event, that's fun. It's a lot. I say it's fun. It's fun for the kids. It's nice to get out and see people in the community, but it's really about injury prevention. And these children really soak it up. They get to understand why it's important to use crosswalks and what these signs mean. And it's a great age group to work with. So we went to the various 5 Auburn elementary schools. Moravia had an event this week, and then Weedsport for the first time. It's harder in the rural areas because they're not walkable schools, school bus schools, but like Moravia and Weedsport have really tried to create events on their campus. Now we continue with the HAV monitoring. I think one of our points for sharing information about the high level of toxin in the raw water a few weeks ago, is so that people are prepared, keep water on hand. Yes, it could be because of this, but it could be because of a rupture. There's always, it's just good emergency preparedness to keep some water on hand, and you don't have to buy it. You can take it out of your tap and put it on the shelf. Healthy Neighborhoods is underway, which we'll be certainly sharing a little more information about that. I had the opportunity yesterday and today to go to Public Health Annual Conference sponsored by NYSHO. And that was, I always get so much out of that. So I thought I'd just hit on a few of the topics that we discussed here. There were some updates on advisement on public health laws. You kind of heard some of that in the past, Fred, I think, and consulted with people, which was great for people who are newer to their public health positions also. The part that I valued the most was we had 3 state health representatives come. Dr. Ursula Bauer, she's the Deputy Commissioner for Public Health. Carol Rodat, she's the Deputy Director for the Center for Aging and Long-Term Care Policy. And Dr. Douglas Fish, who's the Director of the Division of the Medical Director for Division of Medical and Dental Directors, Office of Health Insurance Programs with Medicaid. So that was really great, not only to understand some of the reorganization and the focus for the State Department of Health. They've just gone through a strategic planning process and some reorganization. I think I mentioned it before, and Brenda hears this all the time. The Center for Aging and Long-Term Care Policy, that is separate from the State Office for the Aging, but it's really the push to help people age at home more because of so many reasons, right? It's better for the individual. It's less costly to the community. It's taking into account healthcare workforce, which is, it's a national issue. It's not just a state issue. So I think we'll be seeing a lot of interesting attempts at revising some of the current regulations. So for example, we look at how visits are made and who can make them, and then how are you reimbursed for them? Kind of related to that, when we look at, it's not just about aging, right? It's about helping our new mothers and our babies. And there's a huge need for prenatal, young family, not just the first time you're having a baby. So many times people get referred to social services down the line. Well, if you have some of the tools and skills and know what to anticipate and know what's typical, maybe things won't, it'll provide you supports that you don't have to get through a social service agency down the line. Plus it's better. It's better for everyone, right? So there's this thought of helping health departments as we've restructured our maternal and child health programs, not only work more closely with different agencies, which are picking up the need for services in the community. So for example, Cayuga Counseling just got the Healthy Families Grant. Now that was something that had been with our community action program previously. It's hard to operate under a grant, right? Because if you don't have the funds, then you can't have the people. And then you can't provide the services. We are really building a coalition in this community with, yes, healthcare providers, but the supportive units, the Cayuga Counseling, Cayuga Health Network, the health department, many entities to be a referral source initially. The plan for the health department, and this was something that started years ago, then had to be put on pause, and now we're picking it back up. We want to make a phone call to every single new mother, right? Regardless of your age, regardless of the number of your children, regardless of what your situation is, get a referral from the hospital that you've been discharged. We're going to connect with you within 72 hours. Say, how's it going? How you doing? are you struggling with anything? But, obviously there's a little more tactful in how we phrase these connections. And then identify, could you use a visit? And sure, like we'll come out and see you. Then we can go do what was called kind of a light touch visit, and then say, you're doing a great job. Why don't we, if you'd like, you can have someone come in and work with you on just how you will bathe your baby, and how you can figure out how to get to the grocery store when you feel like you can't even, get the laundry done. I'm not oversimplifying when you think back about what a traumatic life change that is, right, to have a child. But the nice thing also is the state's going to create some reimbursement mechanism for these type of services. And that will make a beneficial difference to those of us agencies who are attempting to perform this work. So we expect that we'll be seeing some billing code changes, some Medicaid picking up some of these opportunities, community health workers, and finding a way to get reimbursed for the use of community health workers. When we talk about peer supports, that's what we need. I want somebody who looks like me talking to me because they get where I'm coming from. It's all about social determinants of health and equity and providing service to give, the healthy start to families, to help them keep them and help provide, that pathway for them to thrive. So that was just really inspiring and hopeful. And a whole bunch of the topics here, but I think the other thing which is going to be a big deal to be looking forward to, and I look at my social service counterparts here because you might hear about some of this before I do. I might hear about it, is a new Medicaid waiver program 1115, totally based on social determinants of health. There's going to be some RFAs coming forward. Some of you who were here a few years ago might remember DSRIP, which was a Medicaid redesign, all based on value-based payment, keeping people out of repeat visits to the hospital was really the focus on that. Yeah. This is really going to be more prevention and service-driven is my understanding, but there's a lot that we don't know yet because at the federal and state level, they're still figuring that out, but I expect that we'll be hearing a lot more. There really should be some community groups pulling together to say, how can we make use of these funds that will be coming forward to help the people in the community. So I expect we'll hear more as that moves forward. So that's all I have to say.
Great, thank you.
Behind you.
Elaine?
I love our staff shows up. I love to talk to
Yeah,
them.
that's right. Go ahead.
How's the lead program?
We're busy. We're busy.
It's like a lead education and training for contractors.
So that we did have a training for contractors in September.
You asked about lead.
Lead, yeah.
To show.
I don't know about Molly.
To teach.
Okay, well, good. I'm
You
glad.
you can wrap your head around lead a little easier than sometimes substance use. We had a successful training. It was really a great opportunity for contractors to understand the process needed to become lead abatement specialists, because when that is necessary, that is a certification which is required to take care of lead abatement in homes when it's really more than this much lead that has to be removed of lead paint. So that was a great value for those participants. They're now, now they can apply for their EPA certification, which is ideal. So right now they can do their own stuff. They can become certified EPA contractors as the next step. That's on their dime, but this really gave them all the education and the base to be able to attain that.
And some of your lead grant funding can pay for those services. Is that?
Primary prevention. And so that's the really wonderful thing about the grant that we have currently is it's trying to go to the source and make the permanent changes to prevent lead poisoning. Before, we were absolutely reactive, right? We didn't go into someone's home until there was a poisoned child. So this is really an opportunity to work with property owners, be they individuals. And that was, this was another interesting thing that was talked about, was the idea of trying to create loan programs for homeowners that are zero interest, because we can come in and say all we want. You're ordered to fix this problem and you have to hire the contractor to do it. Well, that is a costly undertaking, and people typically want to do the right thing, but it costs money. So wouldn't this be a wonderful thing to have a mechanism to be able to apply for a loan to accomplish what needs to be done, but not have 9% interest on that loan in order to do that? So that was discussed. That hasn't moved forward. But the poisoning prevention, we're actually hoping to do a program in the springtime. We had talked about this last meeting. I think I mentioned briefly, maybe could we do a presentation at the legislative meeting, but we want to get a little more under our belt and get some more statistics together as to what we've done locally with our lead task force and with our lead initiatives, lead poisoning prevention initiatives, and be able to present not just historically what we've done, but what are we doing currently that is really helpful? How are we working with healthcare providers to get children tested sooner? That's necessary. But how are we working with families to educate and working with property owners to abate the problem? We're going to have the most impact if we can get to the source and just take care of the problem. Because once that building is taken care of, it's never going to be a problem to anyone ever again, right? That's the way to get ahead of this program. We are anticipating CDC has lowered the poisoning rate again. The state has not adopted that yet, but we anticipate that will be happening shortly, which will then only increase the number of children that we case manage and go into their homes. We have seen more people take advantage of the opportunity we have to go into their homes upon their request to really zap the areas in their home that may have lead paint. And we can provide education about, there's lead paint here, you don't have a poisoned child. But, if it starts to get chipped, just paint over it, get ahead of the program so that you don't have to strip all the lead. You don't have to create the dust, because that happens too. People think they're doing the best thing for their family and their child. But unbeknownst to them, sometimes during renovation projects, they create such lead dust because they didn't know the proper means to hang the drapes and to wet scrape. And the dust circulates and you have your toddler crawling around on the floor, and it might not look dirty, but there was enough there. And we've had children poisoned through very unintentional, when I say that, people trying to do the right thing, unintentional, causing a lead hazard in their own home, which, that's just heartbreaking also. So there's a lot happening. So we'll be learning more.
I think, this is an impossible question, but does the department have a sense about what the percentage of the housing stock out there has the potential for lead that needs to be abated? Is there a percentage that we know of?
So we base it on the age of the housing stock.
Oh.
So we know the city of Auburn, I'm not going to do it justice, has at least 90% of the housing in the city is before 1980. And a really high percentage, if I say a number, I'll be wrong, but it's
Right.
almost as high a
Housing
percentage
stock
in the
before
county.
1980.
Yeah,
In a
because the
city
lead
as old
paint,
as this?
Yeah.
We're in trouble.
the lead paint was stopped being generated in 1978. It stopped being manufactured. But of course, you keep a can of paint around to paint stuff,
Right.
right? And
Right.
so we look at every home that was built before 1980 as a potential, but of course, every home is not. Some have been taken care of and the lead has been abated. But I think the thing I've learned the most, it's incredible how little lead paint causes significant developmental problems in a growing child. It's astonishing. Okay, thanks.
Thank you.
No resolutions this month, but I promise I got at least 2 or 3 for next month. Morning. The only thing I want to add to my report, and one of the nice things about sitting through everybody else's is I really appreciate what everybody else is doing, and think I just am always odd when I really listen. And I wanted to mention that one of the really nice things that's been happening is that we've been partnering more with some of the other departments. So it's been really great. We have done the Best Shot campaign with the bag from the health department, and we're sending those out with we sent them out with our farmers market coupons, and then we're also sending them out with the emergency meals that we give all our nutrition clients for the winter, for the closures due to weather and such. And then we're also including in those bags the Healing Communities Dispose RX options that's going in there with the little bottles so that the seniors are getting those. So the collaboration is really great. So thank you guys for doing that. And then we got an upcoming discussion with Healthy Neighborhoods related to falls prevention. So I just wanted to mention that again. It kind of came up by listening to all the good things that everybody's doing and working together. But any other questions or anything?
So you're still working on getting that car, any timeline? You noticed in your report that you working with Don Carr to get a car, but no timeline.
No.
Okay.
Oh my gosh, I wish we could get the car. Everybody's trying to buy a car recently.
Elaine G.
Well,
Oh, I'm sorry, Jim, go ahead.
Well, to follow up on what Heidi asked about the car and stuff, is it something so special that
No, it's a small SUV. That's all we need.
Those
So-
are the hardest to get
if
right now.
it's state contract, I mean,
Don's put the bid in. He puts it out there and we're not getting responses. He was going to try to piggyback on somebody else's from another county. I said, I'm willing to drive to Saratoga if we can get it through them and what they're getting. And
we go to Victor to that Van Buren or whatever it is, or One Bundle, or.
so they all,
He's got like a dealership that's got.
and I have contacted a dealership, but Don says we got to go through this process. Any of those dealerships can participate in this government process online.
If they're state contract, you don't have to bid it. You can go,
It's not bid. I'm using the wrong terminology, but
you go right.
it goes on and lets them know we're wanting to buy a car and they all can let us know if they got cars for us. I wish I knew the right terminology.
I guess the reason I'm asking, and it's interesting, it's an SUV. We have to buy a fly car for the village of Fairhaven. They have one up there. We're gonna have it outfitted. We can have it in no time at all. And
you
it just came up a month ago. And they're little SUVs. They call them fly cars. They do them so that if it's a call that we don't have to send out a full rig or an ambulance, that car can go right to the scene. Sometimes they can help people and they don't even go to the hospital or anything.
Sounds good.
So
It's in a very, very local dealership, you said?
it's in Victor. They're the local dealer that does it. We're getting ready to buy a plow truck from them and I don't know, they seem to have a lot of vehicles, and if you're buying a 2022, you probably get something. If you're waiting for a 2023, yeah, you may not get it, but 2021s, 2022s are sitting on the lots. You can't be selective on color.
I just want a vehicle.
Huh?
Before someone takes the money back. Right. Yeah, I know how you think.
Okay, I'm
Thanks
just,
for the input. Maybe.
who you talking, yeah, I don't know how we do that in-house here.
Maybe if you could send that dealership's information over.
To Don.
Yeah, and see if we can contact them.
Mhm.
Can't hurt.
Right.
Who's the guy?
Don Carr is
Purchasing.
Oh, Don Carl.
Doesn't he live up there?
Somewhere.
Your neck in the woods?
Yeah. Name my car, you gotta be able to get.
That's right. You still have issues with the Moravia route and
Yeah, we have a real shortage of volunteers down in the Moravia area. And, we are kind of talking about what that impact is going to be, because if we can't have enough volunteers, then it might mean that some of the routes or some of the times we're going to have to limit the deliveries to like Monday, Wednesday, and Friday, or whatever we have to do to combine it. And we don't want to do that because part of our program is checking on individuals every day. and making sure they're okay, especially, in that's a very rural area that we're delivering. So there's advertising going in the shopper down there right now, putting the word out. Yeah, just thank you for asking, because I know none of you here are from the southern part, but I guess the more people that know, the better. We're really desperate for volunteers down there.
Is there any person that they could talk to from the towns, or, I don't know how to recruit people from the Moravia area to go to the town supervisor. Would there be?
Woodward, maybe have some
Well,
contacts.
So for up in my way, I don't know who you talk to, maybe Frank Perkins, because they have the seniors group and sometimes they're looking for things to do.
I'm going up there in 2 weeks, so I will be there talking. Our shortage isn't up there at this point. It really is the Rock, Summerhill, Moravia.
Just had a thought, our scat band people might be a resource.
Good thing, glad you brought that up. We just did another ad on Facebook. We had it's a dual ad for volunteer meal drivers, volunteer scat drivers. Yeah. We don't want to pull from each other's, but we want to pull in drivers from the community, either whether they want to drive a car or a van. Yeah, whichever they're willing to do.
And it really is a couple hours a day.
It is. It's not bad. It's nice. There's some winter days that aren't, but for the most part, it really is great. Means a lot to the folks that you go see. People get very attached.
All right, anything else for Brenda?
Thank you.
All right, great. Oh no, we could get a motion to adjourn.
Motion, second. Aye.
That wasn't it. I had a question.